Nearly two-thirds of men in their 60s have an enlarged prostate, which can lead to a range of symptoms.
In HealthWatch, Shelley Botat tells us about a new treatment that can improve the quality of life for patients.
Wayne Coleman is an avid outdoorsman. He spent 24 years as a conservation officer and even wrote a book, Tales from the Deer Blind, a game warden's memoir.
Love of the outdoors.
10 years ago, Wayne was diagnosed with benign prostatic hyperplasia, or BPH, which is an enlarged prostate. He was put on medication, but eventually...
Even with the medication, I was getting up during the night to use the bathroom as much as 8 times a night.
It interfered with all aspects of his life, including his job, driving truck.
My driving trips had to be planned around how many rest areas were there along the way. Couldn't sit in a deer blind for very long. That really was a problem.
So Wayne went to Dr. Richard Windsor, a urological surgeon at Aurora Baycare Medical Center. Dr. Windsor says the prostate is a drain for the bladder, and an enlarged prostate can cause a blockage of the urine's passageway.
So now the bladder's straining a lot more, pushing a lot more. It's very irritated, so men feel they need to go more often. They have more urge. Their streams decrease. They have to push or strain to go against that blockage.
Dr. Windsor changed Wayne's medications, which worked for a while, but then his symptoms came back.
Not being able to do anything for any length of time without taking a bathroom break.
Wayne had several treatment and surgical options, including resection of the prostate,
where we actually remove the tissue with a hot wire.
Wayne chose a minimally invasive enlarged prostate treatment for BPH that opens up the prostate with no cutting, heating, or removal of tissue.
Then we pass a catheter in and we push the prostate aside to open it up. And while we have it aside, we put a retaining suture in there that holds it open. And this implant stays there permanently.
Dr. Windsor says the procedure has advantages over other more invasive ones. 1,
less catheter time. 2, fast recovery, getting back to activities such as heavy lifting sooner, say in 7 to 10 days rather than 6 weeks. Fast recovery and normal voiding.
Wayne noticed the difference right away.
The symptoms disappeared immediately. I'm sleeping through the night.
He was back to work within 5 days and no longer worries about long rides.
Drive for 4 hours before I have to stop.
And Wayne's enjoying more time in the outdoors.
Spend more time in the deer blind.
Dr. Windsor says the procedure has a 90% success rate. To learn more, you can call Aurora Baycare or email HealthWatch at aurorabaycare.com. And that's your HealthWatch. I'm Shelley Botat, Local 5 News.